Are you preparing to travel for the holiday season? Well, you got to pack maybe one more thing, a little extra cash maybe for a test, or maybe you pack the test with you. There are new travel restrictions that we have to tell you about, and they're in the wake of, a rise in cases really around the world. Coronavirus cases and deaths have been rising across the U.S. as the holiday season is in full swing. For the first time since October, the 7-day average of new daily cases is topping 100,000. That's according to the CDC. Delta is still the main source of infections. Even so, concerns over the recently detected Omicron variant have forced the White House to implement tighter restrictions for international travel. Passengers are now required to provide a negative COVID test 24 hours before their flight. Charlie D'Agata has the details.
Those new travel restrictions went into effect at midnight. That sent Americans scrambling over the weekend to make sure that they could travel today. It's not chaos, but lots of confusion.
Hello there.
Before heading back home to Wyoming, Sue and Bill Lee had to make an emergency stop at a London clinic.
We want to go around roughly 3 or 4 times in a circle.
After the CDC dropped the new rules about testing.
We've been listening to the news. News was saying that the states were going to up it to 24 hours. We finally got the word that we need to do it in a 24 hours time.
We should mention here they're visiting their son, Ian Lee, London-based CBS News correspondent. And they say the test itself was a breeze.
I mean, I was expecting it to be tougher than it was, just from what your friends tell you, but really it was nothing. It was very easy to do.
But like other U.S. travelers, they found themselves in a hurry-up offense after last week's White House announcement.
I'm announcing today that all inbound international travelers must test within 1 day of departure, regardless of their vaccination status or nationality.
That used to be a 72-hour test before flying, leaving Americans to wonder where, when, and exactly how to get tested.
We found out just randomly, so now we're like, well, do we wait? Do we do our test today? Do we do it tomorrow?
It is expensive, yeah, especially to get fast results. Same-day results is more expensive, so yeah.
Now, it's largely down to the airlines to inform passengers of new changes. Here in the UK, it's relatively straightforward, but it's not cheap. A walk-in clinic, you'll get the results back in around 3 hours. It's going to cost you around $100. Anne-Marie?
That's a lot, especially if you have a whole family to pay for. Thanks, Charlie. Joining us now is Dr. Leslie Diaz. She is an infectious disease specialist at Jupiter Medical Center in Florida. Thank you so much for joining us. The Omicron variant has been detected in at least 17 states now, but Delta continues to be the drive behind the national surge. And it looks like, at least by comparing the two variants, Delta is the one that is the most dangerous in a way, in that more people end up in the hospital because of Delta. With that in mind, what kind of impact do you think these travel restrictions will have on the spread of COVID-19?
Good morning, Anne-Marie. Those are very good questions. The travel restrictions really have not panned out in any type of meaningful studies to result in something that is significant in containing these variants that are so transmissible. And the reason for that is that by the time you do the travel restrictions, the variants are already in the community, spreading very efficiently and causing some sort of disease within the different communities of the country. So I know that it's been very politicized in the past, but the truth in the matter, there's really not good data that says that it really works. Although the theory behind it sure makes sense, it's left to be proven.
Yeah. President Biden's chief medical advisor, Dr. Anthony Fauci, addressed the Omicron variant on CNN this weekend. Here's what he said.
Thus far, it does not look like there's a great degree of severity to it, but we really got to be careful before we make any determinations that it is less severe or it really doesn't cause any severe illness comparable to Delta.
All right, so what do we know so far about the Omicron variant?
What do the scientific aspect that we sure do know is the fact that the variant has many more mutations in different sites, mostly in the spike protein of the virus, and taking that into effect, it makes us think that it is definitely more transmissible. The question remains, and there's a lot of questions about Omicron, and we just don't know them at this time, is that is the disease is more severe? Are we going to have more hospitalizations? And is the mortality increased as well? So, and also the vaccine effectiveness against this variant, we just don't know it. And these are scientific facts that are going to be surfacing in the next month or so, hopefully, but we just don't know at this time. The fact that we have vaccination rates that are higher than, let's say, South Africa, makes me think that maybe the effects on disease and hospitalizations as well as mortality may not be as severe.
Can we expect this to be the new normal, that, you know, every few months or so a new variant's going to pop up, and then we're going to have to kind of almost be following behind it to determine whether or not it's really bad or it's manageable, whether or not our vaccines are effective? Should we just get used to this?
That's a very good question, Anne-Marie. I really don't know exactly what that answer is, but as long as a virus is in the community and we allow it to propagate, it will mutate, because that's the nature of that beast. Unfortunately, I think we lost the window of opportunity a long time ago by not getting our communities more fully vaccinated in the order of 85% or more. That would have really done the job in containing this virus once and for all, I think. But that, like I said, that window of opportunity is lost. So I think we're going to have to deal with the different variants as they come along. The more we vaccinate, the better this will be.
There's a new study that shows, speaking of vaccinations, that shows the Johnson & Johnson shot can be an effective booster shot for people who are fully vaccinated with Pfizer. How does mixing and matching work?
Well, mixing and matching is definitely something that we need to consider, no question, especially when there are areas that we do not have full accessibility to all three. So it is very much permissible, it is safe, and there is no difference in side effects or anything like that as compared to the original vaccine. There is a small study that is still ongoing. And when I say small, I'm talking about 400 and something patients that says that it may even be beneficial to mix and match, but that data is still early. So I promote it, I recommend it, and especially on the immunocompromised patients, you may get an added benefit.
You know, we've been battling COVID for 21 months now, and particularly as we're hitting the holiday season. There are a lot of events that I would have gone to last year, but they were canceled or they're modified and switched to being sort of all outdoors. And now it seemed like this year we could kind of get back to what we were used to. And just a few weeks ago, you know, I got a sort of a list of events that were happening in December, and you know, our family was sort of going through what we were going to attend, and you know, yes, no, yes, no. And now suddenly, 2 weeks later, some of these events I'm really concerned about attending. They're indoors. They're with people who are not in kind of my bubble group or extended bubble group. So much has changed, But some people are just sick of it, and they're ready to go forward with the plans that they already had in place for the holiday season because they want to enjoy themselves. What do you tell patients who are just feeling pandemic fatigue at this time?
I share those sentiments, Anne-Marie. Every one of us it has fatigue with this, no matter if you're a provider, no matter if you're a patient. It really doesn't matter. I can't say with a blanket statement that you should move on and live your life like you would normally live it, because everybody is an individual. There are patients that have significant comorbidities that need to be much more careful about joining a group of individuals who have no idea if they're vaccinated or not. And it's like you said, it's not your group of individuals. Unfortunately, there's the human factor in all of this. And it's almost, especially in this state, you have to take their word on that they're vaccinated or not. And that human factor is sometimes not as reliable. So you have a risk stratification that you have to do in your mind, speak with your physician. And I think that getting guidance based on scientific data is the right way to go. Always going back to the science and what we do know, because what we do know is a lot. We know that the Delta is still the number one transmissible virus in the United States. Yes, we have seen Omicron in different areas. Is not, we don't know how vast it is in the community yet. We don't know how it's going to behave. So if you are that individual that has multiple comorbid illness, you have not been fully vaccinated and boosted, I would take a lot of caution in getting together with groups of greater than, let's say, 10 people, and that it is the unknown if they're vaccinated or not. So you have to really look at the individual person and discuss it with their physician to see and risk stratify of what is the risk of you contracting this. And, I always say that, it's not scary to get the virus because, we treat you. If you go into the hospital, we give you the treatment that you need. The scary part is if you survive it, the consequences of the virus that it can do for long-term effects. And that's very scary. So you have to really take into account the different scenarios of what you're going to do as far as getting together with individuals that you don't know.
Yeah. I think that's great advice, and I think it's a really important reminder that for many people there are long-term health implications, even if they come out of the virus initially seeming unscathed. There are all these other implications that are possible. And I remember hearing somebody talk about it as a risk budget, just like you would do a budget for your household and you determine, what's worth spending your money on. It's the same thing. You're kind of explaining that you have to determine is it worth the risk? If you go to this party this week and you're planning on traveling in a couple weeks, is it worth the risk of exposure, knowing that if you test positive, you won't be able to travel? And that's kind of something that everyone has to sort of decide for themselves with, as much knowledge as possible. Dr. Leslie Diaz, thank you so much.
Thank you for having me, Anne-Marie. Have a good day.